Good morning. On this holiday, which commemorates the emancipation of enslaved people, I want to welcome all of you, graduates, family, friends, faculty, and staff, to our most challenging and amazing convocation for our 2020 graduates. We are certainly honored to have you with us as we celebrate this event. This is a challenging convocation because as a nation and as individuals, we are facing a major struggle for social justice and equity in the middle of a serious challenge to our health and well-being. This is an amazing convocation because of what our graduating students have been able to accomplish in the face of these very personal challenges and stresses. Today, we are celebrating their accomplishments, their creativity, their compassion for others, and their insights into our current serious issues. You will soon be able to see for yourselves the talents of these graduates in their personal videos. Now, I would like to welcome our Dean, Dr. Tracy Collins, who is just finishing her first year with us. I'm sure she never thought this would be how our first year would play out. Welcome, Dean Collins.
Greetings. I'm very honored to join you today. I really wish I could be with you in person, but please know I am with you in spirit and I share in your excitement and sense of accomplishment. Over the past few months, you have persevered in the face of considerable adversity so that you could complete your degree requirements on time. I appreciate your patience and adaptability while almost overnight, we converted much of our instructional curriculum to a virtual format in response to the COVID-19 outbreak. We all have had to become more adaptable in these trying times. I'm nearing my first anniversary as dean, and I must say this first year wasn't exactly what I would have anticipated. Who starts the year expecting to develop a crisis response to a global pandemic? So over the past few months, I've been so heartened by and deeply impressed with the resiliency and creativity of our faculty, staff, and students. Working together, we got it done. Now we are all facing an unprecedented challenge. This pandemic has claimed hundreds of thousands of lives here and abroad, strained healthcare resources to the breaking point, and disrupted the world economy. At the same time, the most successful measures taken to limit the spread of the novel coronavirus have been a textbook example of population health in action. Here in New Mexico, our college has been working with tribal, African American, and Latino communities that have been among the hardest hit by the COVID-19 outbreak. These vulnerable populations in our state really need our help, and I'm so proud of the devotion to service that I see among our students. During the pandemic, we've seen Dr. Anthony Fauci and others make recommendations for flattening the curve of new infections to protect the healthcare system. We have all become familiar with the essential elements: practicing physical distancing, wearing masks, self-isolating, and monitoring. But the global pandemic is not the only crisis facing us in healthcare. Today is June 19th, or Juneteenth, the ceremonial holiday commemorating the proclamation of the federal order freeing enslaved people in the US. The holiday was first celebrated in Texas in 1865. This observance comes at a time of intensified focus on racial injustice in its many forms, including inequity in our healthcare system and the disparate impact it has on health outcomes for far too many members of our society. We see this very clearly with the outsized toll COVID-19 is taking on people of color. These injustices are still with us after 155 years. We are called upon to do better. Whether controlling a pandemic or rectifying health disparities, we will only see success when public health entities, healthcare systems, and the private sector work together and coordinate their efforts to win buy-in from the public. Of course, we know that people who are trained in population health have the ability to bring together diverse stakeholders to achieve a common health goal. So in a sense, Dr. Fauci has done a great job of marketing our college and all it has to offer. The education you have received in the college really has equipped you with unique skills for addressing this pandemic and other health emergencies. In this complex and ever-changing world, I expect you will have a vital role to play in shaping our future and influencing population health. These tools will serve you well in diverse settings as you enter the workforce. You might find yourself working in a health department, a hospital, for a managed care organization, or even at the Centers for Disease Control and Prevention. Whatever the setting, you will be prepared. In closing, I want to congratulate you on what you have achieved thus far. Please know that I'm eagerly looking forward to seeing what you accomplish in coming years. The future truly is yours to realize, and I hope you will take what you have learned and commit to making a difference. Congratulations, class of 2020. I would now like to introduce our keynote speaker, Dr. Jerome Adams, the Surgeon General of the United States.
Hello, I'm United States Surgeon General Dr. Jerome Adams. Though this may seem like an especially challenging time to enter the public health workforce, I want you to know that you've chosen a profession which more than ever is playing a critical role in the lives of our entire planet. There's never been such a spotlight on the important work of public health, and your knowledge, skills, commitment, and compassion have never been of greater value. Now is your time to shine and to be heard, so I hope you've been working on your Twitter profiles. In all seriousness, though you've all chosen areas of focus, you'll discover your career has many unique chapters and opportunities that extend far beyond what you've imagined for yourselves. I started out with a focus on chronic disease prevention and never imagined my public health legacy would revolve around HIV, Ebola, Zika, and now COVID-19. Let that be a lesson to you all. There's no escaping infectious diseases. No matter your area, we all have a role to play in promoting good prevention practices and especially promoting vaccinations. Now, I'd like to leave you all with a few pieces of advice. First, dare to be innovators and disruptors. A novel coronavirus has shown us that it's time for new thinking. And never before have graduates entered their careers with so much opportunity to think outside the box and to shape the future of public health. Second, strive to really get to know people, and above all, to be good people. All of us in public health can get a little preachy and judgmental on occasion and forget that our experiences and priorities aren't always the same as those of the people we're trying to engage. My favorite saying is that people need to know you care before they care what you know. So whenever you're struggling to connect with or convince your audience, remember, it's usually due to a lack of trust versus a lack of knowledge transfer. And finally, practice good self-care. One of my biggest laments, having lived through multiple crises, is the toll I've seen these responses take on the responders. But just as a car can't go as far or as fast on a flat tire, you and your colleagues can't give your best effort if you aren't mentally, physically, and spiritually running on all cylinders. So from the Surgeon General and nation's doctor to the newest members of our National Health Army, I want you to know I couldn't be more proud of all of you. Congratulations, class of 2020.
It is such an honor to introduce the next two speakers for this section of the program. These students were nominated and selected by their peers to represent them at this convocation. Our first speaker is our BSPH graduate, Sasha Burlingame. She has earned a Bachelor of Science in Population Health as well as a second major in Spanish. During her years at UNM, she also found time to spend in Chile to polish her Spanish. Welcome, Sasha.
Hello. Now, let's start from the beginning. Population health. What is it? Is it public health? Is it pre-med? What populations do you study? These are some of the more common questions I receive when I tell people about what I study. Regardless of where the conversations begin or the amount of explanation I have to give, I have a pretty solid spiel by now. The end always leads to the opening of another door. This is the essence of population health. To answer the earlier questions, yes, population health can be public health. Yes, population health can be pre-med. Yes, population health does study populations, typically human. And yes, in short, population health is the study of all that contributes to the health of individuals, local communities, and our global populations. We are taught to look upstream and to examine the causes of the causes of the causes. We are taught compassion and cultural humility and how to turn raw data into actionable knowledge. We are taught how sound policy can bolster health and how the environments in which we live and work affect our health just as much as the choices we make. We are taught how to use theory to guide our interventions and the importance of evidence-based practices. Population health is the door for the next generation of innovative thinkers who will use their skills and knowledge to better our local and global communities. The class of 2020 embodies the essence of population health. My peers and I come from all different backgrounds and experiences and an array of interests. It is this diversity of thought that has propelled us, challenged us, and taught us the invaluable knowledge that now we can share to better our growing communities. A degree in population health opens the door for my peers to bring their expertise to local schools, hospitals, clinics, research facilities, and a plethora of community organizations. It also opens the doors for work opportunities abroad. My cohort will become teachers, mentors, physicians, policy writers, community leaders, and most importantly, critical thinkers, well-equipped and passionate about making lasting and sustainable change. It is our duty as population health practitioners to serve the public and engage and challenge the systems to work efficiently and cohesively for the populations they serve. Our knowledge carries responsibility for action. Regardless of what sector we choose to dedicate our work to, it is our responsibility to use our knowledge and skills to open the doors to equitable change for the populations we serve. Change does not come quickly or easily. However, the commitment and tenacity that my cohort exhibits will propel and initiate progress that will foster meaningful change. I chose population health sort of by luck. When I began college in 2016, I initially chose biology as my major, with the intent of applying it to a career in healthcare. I quickly learned that biology provided much too narrow a focus into the determinants of health. I began searching for majors or classes that incorporated a broader perspective, and it didn't take long for me to find the COPH. I found it on a Google search, and I initially reached out to enroll into the introductory classes. I did not know what to expect, but I found that these classes, filled with misfits like me, provided the answer to my desire for a broader scope of thought, and they sustained my curiosity for an alternative path to the health sciences. I feel prepared to tackle the current and future health challenges that pose threat to the health of our populations, and I am confident that my cohort and future cohorts to come will serve the public in lasting ways. I am lucky to be part of the COPH, being one of 3 undergraduate programs in the country, and to be part of the next generation of innovators of health solutions. Our world is in the midst of major change. It cannot afford to remain in the same pattern of thought, nor can it rely on precedent. The power of population health and the responsibility of population health practitioners is to open the door to alternative solutions and progressive thinking that fosters, empowers innovation. We are at the precipice, and graduation is just the turning of the door handle. I speak to you today knowing that the path ahead will pose challenges. However, I am confident that my peers and I are aware of the challenges we will face and are soundly equipped with the knowledge, resources, and passion to address such challenges. I want to thank my peers, my professors, my mentors, my family, and my friends for the support and willingness to have the dialogues that are hard and lack clear answers. To those who have supported me and my peers, thank you. To those who have challenged me and my peers, thank you. Now, let's go open some doors.
Thank you, Sasha, for those very positive thoughts that will take us forward in these times. Next, I would like to introduce Lenora Wakanda, who is our MPH student speaker. Lenora has been an important part of this graduating MPH cohort as it has experienced all the challenges and the joys of learning how to be a public health practitioner. Welcome, Lenora.
Gawatsi Halpa. Hello, everyone, and thank Dean Collins, members of the College of Population Health faculty, administration, parent, family, and friends, honored guests, and graduates. Thank you for inviting me to speak at this magnificent and long-awaited commencement ceremony. I am honored and humbled to be among you today. A famous physicist said, "Nothing in life be feared, it is only to be understood." Now is the time to understand more so that we may fear less. That wise physicist was the first woman to be awarded a Nobel Prize in 1993 for her contributions to physics. Her name was Marie Curie. Fear, uncertainty, doubt. I'm sure these are all emotions we have felt as undergraduate and graduate students during our time here at UNM. I'm sure even our parents, families, and professors have shared in these same emotions. I know I felt each of these when faced with Dr. Toloshrup's infamous epidemiology problem sets, the confusing language that is biostatistics, and Dr. Sanchez's semester-long interventions project. While each of these tasks seemed to ignite my anxiety, they also allowed me to understand the foundation of public health. When I began the Master of Public Health program 2 years ago, my understanding of public health was minuscule, and most of my family thought it simply meant you worked for a health department. But boy, oh boy, have these 2 years expanded my public health knowledge. I have had the honor and privilege of learning from some phenomenal professors and public health professionals. I could say a lot about how eye-opening it has been to learn so much about how to make communities better, plan interventions, and determine needs. But at the end of the day, each of us graduates are about to complete our public health degrees in the middle of a global pandemic. And I hope that everyone will understand how important public health is through their parents. Most also work part-time or full-time. Some are healthcare professionals, and every single one is a unique and wonderful contribution to this space. I fully believe every one of them will go out and make the world a better place than they already have. During this time of fear and uncertainty, I have been thinking a lot about what my degree means to me. Watching a pandemic unfold has made me even more certain that this will be my life's work. Removing structural barriers to healthcare, fighting fiercely for social justice, advocating for human rights, and finding ways to make our systems work for everyone, not just the privileged few. You see, this is what I've come to understand is the definition of public health. It is more than just the science and act of preventing disease. Public health also involves addressing the social determinants of health to create a more equitable society for every human being. This includes people of color, the entire LGBT+ community, women, incarcerated individuals, people experiencing homelessness, low-income individuals, immigrants, undocumented people, children, the elderly, people with disabilities, drug users, sex workers, and literally every other person. The preamble to the Constitution of the World Health Organization states, "The enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being, without the distinction of race, religion, political belief, economic, or social condition." If you ask me, the profession of public health is a bit daunting and can easily evoke fear. Yet we should all feel proud knowing this work is spearheading change in order to create a more health equitable world. In fact, during this challenging and unprecedented time, the world needs graduates like us. People with our quality of mind, willingness to follow our passions, willingness to question conventional wisdom and rethink old dogmas, and desire to contribute and improve the life of others. After today, we will begin our journeys as public health professionals, and knowing we are making a commitment to serve our communities, our tribal nations, our families, and all others can make us each feel a bit fearful. But remember, you can't do this alone. Be open to collaboration. Working alongside communities and hearing the ideas of others is crucial in making a lasting impact. No one is here today because they did it on their own. We're all here today because someone gave us strength. They have helped us get here. And that understanding alone should make us less fearful. You're all here because you are smart and you are brave. And if you add kindness and the ability to calculate hazard ratios and relative risks, then I'd say you make up a pretty awesome public health professional. With that, I am blessed to know each and every one of you. I cannot wait to hug everyone when we can finally celebrate in person. Tawae, thank you. Congratulations to the UNM College of Population Health class of 2020. Now let's go make real change.
Well, thank you very much, Lenora, for your very thoughtful and encouraging comments that the class will take on forward with them, I'm sure. Now the part of the program that you all have been waiting for. Dr. Victoria Sanchez will introduce each of our college graduates. They're a little nervous, but it's okay, who will have their own special spotlight. Dr. Sanchez?
Thank you, Dr. Tollerstrup. Good afternoon, everyone. I am pleased, I am joyful, I am happy to present the Bachelor of Science, the Bachelor of Population Health class of 2020. First graduate for the Bachelor of Science is Jasmine Maria Riel. Jasmine will graduate summa cum laude with a Bachelor of Science in Population Health and a minor in Chemistry. Next, Andrew J. Baker graduated with a Bachelor of Science in Population Health with a minor in German and a Bachelor in Political Science with a minor in Population Health. Next, Sasha L. Burlingame graduated cum laude with a Bachelor of Science in Population Health and a second major in Spanish. Ashley Dodd graduated cum laude with a Bachelor of Science in Population Health and a minor in Community Health Education. Johnny Fajardo graduated summa cum laude with a Bachelor of Science in Population Health. Teresa Gagliano graduated with a Bachelor of Science in Population Health and a minor in Psychology. Mireya R. Gonzalez graduated magna cum laude with a Bachelor of Science in Population Health and a second major in Spanish. Catherine Green graduated magna cum laude with a Bachelor of Science in Population Health with a minor in Psychology and a Bachelor of Arts in Psychology with a minor in Portuguese. Is Marisa Griego there? Marisa Griego graduated cum laude with the Bachelor of Science in Population Health and a minor in Psychology. Kiana Marie Holian graduated summa cum laude with a Bachelor of Science in Population Health and a minor in Psychology. Kyle Jaramillo Cudis graduated magna cum laude with a Bachelor of Science in Population Health and a minor in Psychology. Cynthia Leon Lascano graduated summa cum laude with a Bachelor of Science in Population Health and a second major in Spanish. Sierra Maple graduated magna cum laude with a Bachelor of Science in Population Health and a Bachelor of Arts in Biology with a minor in Population Health. Ryan Martin graduated magna cum laude with a Bachelor of Science in Population Health and a minor in anthropology. Amanda Maria Martinez graduated magna cum laude with a Bachelor of Science in Population Health and a minor in environmental science. Trevor Silva Caldwell graduated magna cum laude with a Bachelor of Science in Population Health with minors in biology and chemistry. Kabita Subedi graduated with a Bachelor of Science in Population Health and a Bachelor of Arts in Women's Studies with a distributed minor. Edna Torres graduated cum laude with a Bachelor of Science in Population Health and a minor in Spanish. There you are. I now present the Master of Public Health class of 2020. Jessica Casel Carr graduated with the Master of Public Health. She was mentored by Victoria Sanchez and Michael Pride and will be hooded by her husband. Gabriel Garden graduated with the Master of Public Health, mentored by Francisco Sotomas, and would have been hooded by his friends Miranda Villarreal and Cristina Falos. There you are, Gabriel, being hooded on Mount Hood.
Wow.
Jamie N. King graduated with the Master of Public Health, mentored by Christine Talistrup and hooded by partner Ryan Hinson. Maritza Rivera Montalvo graduated with the Master of Public Health. She was mentored by Christine Talistrup. Angelica Sager graduated with the Master of Public Health, mentored by Christine Talistrup, and will be hooded by her father, Kevin Sager. Yadira Salazar Sanchez graduated with the Master of Public Health, mentored by Victoria Sanchez and Noel Stone, and will be hooded by her fiance and daughter, Ricardo and Jasmine Ramirez. Maya J. Scarpetta graduated with a Master of Public Health, mentored by Nina Wallerstein, and is hooded by her mother, Gia Scarpetta. Summer Shepard Deal graduated with the Master of Public Health, mentored by Noel Stone, and is hooded by her husband, Ben Deal. Lenora Shea Wakanda graduated with a Master of Public Health, mentored by Noel Stone, and is hooded by her parents, John and Deanne Wakanda. Jessica Solorzano Ziegmund graduated with a Master of Public Health and is unable to be with us today. So that was the class of 2020 Master of Public Health. So take a moment and maybe clap in your houses and say congratulations both to our bachelor's and master's students. I see hands clapping. Okay. So each year, the College of Population Health faculty recognize Bachelor of Science in Population Health students who have exhibited professionalism and ethical conduct in two categories: academic excellence and outstanding leadership. This year, we are pleased to present the Academic Excellence in Population Health Award to the following students: Jasmine Maria Abril, Johnny Fajardo, Cynthia Leon Lascano, and Man Nugent, who is not with us today. We are also pleased to present Outstanding Leadership Awards in Population Health to the following Bachelor of Science in Population Health students: Ashley Todd, Sierra Maple, and Ryan Martin. The Master of Public Health faculty recognize students who have excelled academically and exhibited professionalism and ethical conduct throughout the MPH program. This year, the awards for academic excellence in public health are presented to Jamie N. King and Lenora Shea Wakanda. The faculty also recognize Master of Public Health students for outstanding leadership in public health. This year, the award is presented to Yadira Salazar Sanchez. So please join us all in congratulating your fellow students. And finally, we have a final award this year, which we are presenting on behalf of the Public Health Student Association. The Public Health Student Association is pleased to announce the inaugural Outstanding Service Award. The award will focus on the contributions of a student in the Master of Public Health program. This award will continue in perpetuity with a plaque featuring each recipient's names and housed within the College of Population Health. This year, the PHSA is proud to recognize a student who exhibited great leadership and personal growth during his time as an MPH student, culminating in his final semester as president of the association. Gabriel Garden took up the role of president, albeit somewhat reluctant, to address overwhelming student concerns regarding tuition differential and the need for student voice within the college. Gabriel led the PHSA in reaching out to the vast majority of MPH students, organizing information and listening sessions, and taking action when students expressed their concerns. Gabriel was successful in his efforts not only forestalling the tuition differential for the MPH students, but more importantly, being an effective conduit of student voice. PHSA thanks Gabriel Garden for his outstanding service to fellow students and wishes him best of luck in his future endeavors. And now Dr. Tollestrup will come back on.
So as you can see, we have so many amazing graduates, and I have been so blessed to be able to have all of them when they first came into each of their programs, and of having our graduates recite the oath of the College of Population Health. It provides the guiding principles and inspiration for our graduates as they move out into the real world. And for us faculty and staff, it reinforces our beliefs in population and public health. So Lenora Roconda will lead us in reciting the oath. And since it will shortly appear on the screen, you can recite as well with your family and friends. Lenora?
I will work to ensure that people have the chance to live full and productive lives, free from avoidable disease and disability, and supported in their pursuit of physical, mental, and social well-being. I will hold myself to the highest ethics, standards, values, and responsibilities as I move forward the science and practice of public health. I will respect the rights, values, beliefs, and cultures of those individuals and communities with whom I work. I will rely on the evidence to support my decisions and actions and translate that evidence into policies and programs that improve health for all. I will add to the body of research and knowledge and share my discoveries freely. I will continuously seek new information and be open to ideas that can better protect and promote the health of populations. I will advance health literacy for all and seek equity and justice for vulnerable populations.
Recently, thank you, Lenora, for leading us through that oath. And it's nice if you can put it away somewhere where you can pick it up when you're totally discouraged with what's going on in the world and read it to give you some sustenance and courage to move on farther. Recently, I took a break from creating those crazy epi problems to watch the last episode of my favorite show. And I was struck by the closing words. The seasons will always turn, the clouds will gather and the cold will come. We will survive them. We will know wonder where there's been despair. There will be happiness and we will remember it. There will be friendships that we won't forget. Welcome the darkness. Embrace it as a canopy from which the stars can hang. For there are always stars when we are where we ought to be. Amongst the faces we love best, each with our place, each with our purpose, as fixed and familiar as the constellations. The darkness is beautiful, for how else can we shine? When I heard this, I thought it was very applicable to our graduates. They're going to be the stars that show us where we ought to be in the coming years. And now, as the final formal activity of our program, Dean Collins will confer the degrees. Dean Collins.
Thank you, Dr. Tollestrup. Acting on the recommendation of the faculties concerned and by virtue of the authority vested in me by the University of New Mexico Health Sciences Center as Dean of the College of Population Health, I hereby confer upon each of you the degree earned with all of its rights, honors, and responsibilities. To signify your graduation, will you please move your tassels from the right to the left? Congratulations. Now, I welcome Gabriel Garden to lead us in a dance party. You're working sound.
Greetings, everyone. Fellow graduates, congratulations. An awesome achievement. I'm Gabriel Garden, immediate past president of the Public Health Student Association. I filmed the intro to our next activity ahead of time because I'll be from atop Wheeler Peak, New Mexico's highest point, and knew that sound and video quality would be better here at home. Thinking about this year's graduation, I got my gears turning about a fun and participatory way that we could all celebrate this momentous event together. That process gave birth to the COPH song, which is a dance and sing-along celebration experience. COPH, of course, stands for College of Population Health. I used the feel-good and fun instrumental music from the famous YMCA song, but did my best to rewrite fitting lyrics to the themes of public health, teamwork, and social justice. For the chorus, COPH replaces YMCA. Allow me to demonstrate. C, O, your body forms the vertical part of the P, capital H. C, O, P, H. Easy as that. This would have been such a blast to perform together in person, and I'm so sad that we can't. But I still implore you to get up on your feet, dance and sing along, and have some fun. And hey, maybe this or something like it will become an annual tradition for our college. Without further ado, I give you the COPH song. Right after, there's a brief student slideshow presentation, followed by closing words from our dean, Dr. Tracy Collins. Thank you. Peace, love.
Wonderful. I'd like to thank the Planning Committee. And now, in closing, in honor of Juneteenth and the graduating class of 2020, I leave you with the closing statements. I will honor the sacrifices of my ancestors. I will believe in me. I will pursue my dreams. I will help others along the way. Thank you. Congratulations.
It's something unpredictable in the end of the day. You at the time of your life. Something unpredictable, but in the end it's right. I hope you had the time of your life. It's something unpredictable, but in the end it's right. I hope you had the time of your life. It's something unpredictable, but in the end is right. I hope you had the time of your life.
Okay, everyone, that is your convocation. Sorry about the glitches, but I hope everyone enjoyed it.
Excellent job. Congratulations, everyone.
Thank you for all the work you put in.
You're welcome.
Thank you
Congratulations.
all, and it was wonderful to see all of you graduates. I just love this part of it and see you go out into the world. So do good things and think of us.
Absolutely.
Congratulations,
Thank you.
everyone.
Keep
Thank you.
through it.
Congratulations.
Congratulations.
Bye, all.
Congrats.
Congrats, everyone.
You guys